Hello, my name is Reggie Kaye, welcoming all of you to this segment of Health and Wellness. Today we are privileged to have as our guest Dr. Michael Yasner, a periodontist in Cherry Hill, New Jersey, who will inform us of the importance of periodontics and the key that the periodontist plays in the lives of many people. Hello, Dr. Yasner.
Hi.
Most people are familiar with the dentist and the role that the dentist plays in caring for basic dental care. And we visit the dentist twice a year, at least most of us should, and we see the dentist for routine exams and also if there are problems with cavities and dental emergencies and such. But most people don't know what a periodontist does. Can you please explain the field of periodontics to us?
Certainly. Periodontics is the field of dentistry that focuses on the supporting structures of the teeth, the gums, the bone, and, when people need them, dental implants. Periodontists are dentists who have received additional training and are specialized in this area, developing expertise in helping patients treat gum diseases and other dental problems affecting the gums and bones supporting the teeth, and replacing the teeth if and when they should be lost using dental implants.
Okay. Is periodontal disease hereditary?
Periodontal disease is an infection of the gum that occurs when bacteria and germs accumulate in hard-to-clean areas. While an infection is not something people can inherit, a weakness or susceptibility to that disease is something that we find can be an inherited trait. In fact, there are certain genes that can be tested for and identified that can highlight that risk. Of course, by knowing who your parents are and what kind of dental history they have is a good indication as well. While we can't change our parents, we can change the dental condition in one's mouth.
So if the risk of periodontal disease is hereditary, why would somebody be extra careful in taking care of their gums and their teeth and their basic oral hygiene if it's inevitable that they may develop this condition anyway?
The key is prevention. If we can prevent bacteria, germs, tartar buildup from occurring in these hard-to-clean areas along the gum line and between the teeth, one can prevent gum disease from ever getting started in spite of the fact that you may be more susceptible to the condition. So it is worthwhile to focus on prevention and early diagnosis and treatment in all patients, but especially those patients who feel they may be more at risk for these kinds of problems.
Is periodontal disease associated with any other medical conditions?
Certainly. There's been an association that's been established between having untreated gum disease, periodontitis, and higher risks of complication due to heart disease, stroke, diabetes, lung problems, and a whole list of other medical conditions. It appears that there's some relationship between the chronic inflammation caused by infection in the gum that spreads to other parts of the body and increases inflammation throughout one's system. That's carefully being studied now. There's also relationships between other medical conditions putting people at risk for gum disease being worse.
Are diabetics particularly susceptible to periodontal infection because of the slow healing process that they experience?
A perfect example of a condition where having diabetes makes one more susceptible to gum disease because being an infection, and with diabetics more susceptible to most infections, gum disease is no example. If you already have gum disease and you're a diabetic, it's important to control your gum disease, and that can have a positive influence on control of your blood sugars and your diabetes. So these diseases are very closely linked, and treating both together is the best way to make both better.
I see. Now we know that generalized stress is unfortunately a part of everyday life, and we hear that stress causes everything from GI problems and ulcers to cancer. Can stress also play a part in periodontal disease?
Stress affects our whole body, as you correctly stated. It can change the hormonal balance in our body and make our bodies more susceptible to infection. There's a common theme here. Gum disease is an infection. It leads to inflammation, which leads to damage in the gum and bone support of the teeth and potentially loss of teeth. So we do recognize that patients who are under higher stress are at a higher risk of gum disease getting worse. We've had many patients in our practice now going back for 35 years who have been stable for quite a long period of time, and then when they have a medical problem or a high stress situation, show signs of gum deterioration and gum breakdown.
So the more stress one has, the worse the periodontal disease can be. Is that a fair statement?
Quite possibly. Well, I wish I could write a prescription to get rid of stress. We can't do that, but we can work on making sure the environment and the health in the mouth is maintained as good as possible.
So it seems like when somebody becomes a patient of yours, it almost is a full-time commitment that the person has to make in order to improve this periodontal condition.
Yes, there's many treatments we can offer in our practice. We're focusing on both non-surgical treatment options, surgical options to repair damaged gums, but it's really the work the patient does at home that's most important. The primary way a patient can protect themselves from gum disease problems returning is to practice diligent personal oral hygiene techniques, brushing, flossing techniques, and the use of other cleaning tools. A more frequent professional cleaning program, often sharing that responsibility between our periodontal practice and the general dentist's office, with cleaning, say, every 3 months rather than those 6-month cleanings you mentioned earlier, is a very important way to protect their gums against further complications. Certainly if patients have limited problems, we treat them here and then refer them back to the dentist for long-term care and maintenance. For patients who have more moderate or complex situations, we'd like to share that responsibility on a long-term basis, providing that careful follow-up to keep them healthy for years to come.
Now, as with many other diseases, there is an endpoint with the treatment. Does anyone ever graduate from periodontal disease treatment?
Well, yes, if they're stable for many years and maintaining good health, then we may release them back to the general dentist. Unfortunately, some people have problems that persist and require ongoing care and maintenance. So we try to customize the follow-up on the individual's needs.
Now, if the gum disease deteriorates, is there an opportunity or a chance or a susceptibility to having dental implants?
Well, dental implants can be a wonderful solution for patients who have, because of periodontal disease or decay or injuries, lost teeth. Some people have previously lost teeth earlier in life and may be faced with the loss of additional teeth due to these types of dental problems that they've developed. While they have had their first set of baby teeth, their second set of adult teeth, there's now an option for a third set of teeth. And dental implants are metal titanium posts that we can place into the gum and bone support where the teeth used to be to provide new anchors to support new teeth, from individual teeth to sections of teeth to a full mouth of teeth, on a delayed basis or on an immediate basis. So they're very versatile options to allow patients that have lost their teeth or are soon to lose their teeth to have stay-in-place or removable replacements made.
Now, we're very fortunate in that we have so many products at our discretion to buy. But when we go into a store, there's so many flosses and toothpastes and whiteners and strips. How is one to know what is the best products to buy?
Yeah, it's hard when you walk down the grocery aisle. There's just so many choices to be made. We'd like to offer our patients a personalized plan to help them develop the techniques to clean their mouth effectively using proper aids. So we rely on our dental hygienists. We have two wonderful people here, Barbara and Terry, who we've been working with for quite a long time, who can make recommendations to our patients based on their individual needs. Everything from their dexterity to the shape of their teeth to the products they may need to control their dental problems. General dentists have hygienists that they work with as well that offer the same type of advice. So getting advice from your dental professional is really the best way to know that the products you're purchasing are going to be safe and effective at helping you keep your mouth clean and healthy.
Oh, that's very good to know. Well, in closing, I want to thank you very, very much for teaching us about the causes and the treatment and the preventive measures concerning periodontal disease. And I suppose that in the long run, it is easier to keep up than to catch up, and preventative medicine is always the best medicine.
I agree. Well
Thank you so very much.
My pleasure.